Here are comments from PAC facility staff and research nurses discussing their goals for participation and what they've learned so far.
I thought this would be a good project because as a nurse, I've always had to use different assessment forms, definitely the OASIS, and I felt it was so long and time consuming and cumbersome. This seemed like a good opportunity to make a difference and be able to be in at the ground level of seeing how the assessment tools actually come together.
So at Bayada, I think that we want to have a seat at the table so that we can provide our input and be part of the solution for, in this ever-changing and evolving healthcare industry that we work with, so that we can provide the home health perspective and helping to reduce redundancies and improve care delivery. We definitely understand the inherent challenges of collaboration and communication across the post-acute care settings. And we have to be pretty intentional about how we work together going forward so that we can deliver on high quality patient care outcomes at an effective cost. Well, I hope that they, number one, get some perspective on how big this really is, and a little bit more. I think a lot of times when they're faced with a lot of the challenge that they have in the field, especially when it comes to documentation, is why are we doing these things, and why a lot of times I feel like I've documented that somewhere. Is this really our responsibility? And I think that'll help them kind of wrap everything up with regard to treating a client holistically and working with our partnering providers in the community.
Documentation is so much a part of the nursing world, and we do lack in some documentation. And just in the class today, we learned how important it is to document everything that we do so that we can take credit for it and that other facilities can take credit for it when we pass down our residents. Continuity of care. We want that continuum to flow so people don't have to go back to the hospital, that people can do better at home or maybe come back to the SNF that they left instead of going back to the hospital, which will in the end be bad for all of us if they return to the hospital.
I love it. It just has been an awesome fit for me. I love the ability to know that I may have had a part in what is an outcome, that what may come out in an OASIS down the road. And I can say, I was a part of that this part worked or this part didn't. And just being involved in the teaching and helping and seeing where it goes with it and where the numbers are. And it just really has been very intriguing to me.
Here are comments from PAC facility staff and research nurses discussing their goals for participation and what they've learned so far.